Welcome back. And in this next section, we're going to dive into a little bit of the ethics about the use of AI in healthcare and our nursing practice. And AI is going to be revolutionizing how healthcare comes. And I don't want to sound like um, a bad superhero movie or something like that, but with great power comes great responsibility. And and we're going to start talking about the ethical considerations nurses need to be aware of in the use of AI as it becomes more and more integrated into patient care. So first, we have to kind of talk about the data. AI thrives on information, but this raises concerns about privacy and security. Um, as nurses, we must ensure patient data is stored securely. It's used for its intended purpose. It's also um, not giving away too much of the patient um, protected data. So does the algorithm doesn't need to know what their name is to predict something, like these type of things, like it only needs as much data as it needs to do um, these type of predictions and calculations. Um, but on that flip side, like we need to also be transparent with patients about how their data is being used, and in most cases you get some type of informed consent to be able to develop or implement or use some of these AI things. And this is where some of the transparency comes in too. It's going to be a point of contention maybe that some patients don't want some unknown robot to make their healthcare decisions, but we need to, in a transparent way, let patients know that this is only enhancing our ability to actually provide the patient care that they need. Um, and as we think about how these models are being built, bias is definitely one that it keeps coming up. Like algorithms are trained on historical data, and if that historical data is small or it is subjugated to just a one population type, then it's going to end up being biased against others. And then the AI itself will become biased because of the data um, from there. And this could lead to unfair diagnosis or discrimination in treatment plans or even perpetuate existing health disparities just from trying to use technology to enhance our practice. But nurses must be vigilant in identifying and trying to mitigate some of these biases in the AI systems. And this is why we as nurses need to be involved in the development and the actual implementation plans of producing these AI capable models into production. Because who is accountable when AI makes a mistake? And this can be a quite complex question. While AI can be a valuable tool, the ultimate responsibility for the patient care lies with the clinician and the nurses and the hospital providing it. So we need to understand how the AI works, be able to critically evaluate its recommendations, and use our professional judgment to ensure that the best possible care is being presented from our patients. And this is another reason why nurses need to be at the forefront of these technologies being implemented, because we are already using our ethical decision making at the bedside, using our critical thinking to make sure that the treatment plan, that the medications that are being used are appropriate for our patient, because we're the ones who know our patient the best. Um, and AI can definitely be a valuable tool, but we should understand that it can never replace any type of responsibility, whether it is um, um, being in making decisions or ethical reasons that we should do something or not do something. Nurses need to be able to still make those decisions and play that critical role in making sure that patients are in the center of our care. Um, And we need to make sure our patients feel empowered by the informed decisions that are coming out of this augmentation of our nursing practice using AI and this relationship between um, the technology and nurses. And nurses, we need to also consider um, the emotional well-being of our patients, and this is why we can't have an over-reliance on this technology and almost dehumanize the nursing practice. Like it has to be almost a patient-nurse um, relationship just gets amplified by these technologies. And and as nurses, we have a voice, and we should advocate for the ethical AI practice in healthcare. And we should be involved in the discussion about how AI is implemented, raising concerns about potential pitfalls, ensuring that AI serves our patients well, and not the other way around, not having patients serving the AI and its model and how it functions. And finally, we really need to focus on minimizing the risks and maximizing the benefits. And again, this is why nurses need to be involved from the beginning of some of these projects and almost nurse-led AI innovation, because we understand the potential to improve patient outcomes, how to streamline process, and how to free up our time so that we can deliver better personalized care to our patients. And we must remain vigilant in identifying and mitigating some of these risks that can include biased algorithms, um, the disconnect that AI could create between patients and caregivers, or even data breaches can come from our knowledge of all that at the bedside and through different processes like that. And by embracing AI, we can responsibly and ethically utilize this powerful technology to create a future where patient care is not just efficient, but is compassionate, equitable, and empowering.